Hello everyone, my name is Brigitte Dabas, and I will be discussing stress and burnout among healthcare workers. Stress and burnout is becoming more common given the increased demand of healthcare under the Affordable Care Act and its provisions. Healthcare professionals are expected to improve quality care while reducing costs with limited resources. This has led to a decrease in staffing with an increased workload for workers. An increased workload in many cases leads to stress and burnout. Introduction. Stress is defined as a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. Burnout is described as a psychological stress characterized by exhaustion, lack of enthusiasm and motivation, feelings of ineffectiveness and frustration as a result of reduced efficiency or efficacy within the workplace. According to a study, 62% of nurses surveyed reporting suffering high levels of stress. A separate study showed that 87% of physicians surveyed felt moderately or severely stressed. This shows that stress and burnout are very important topics for human resources managers to consider, given that they have to retain and manage a workforce that is highly stressed. An example of stress and burnout among healthcare organizations is Crystal Clear Dermatology. Crystal Clear Dermatology is an organization that does very well financially, but they are currently short-staffed. Them being short-staffed has led to medical assistants at the practice feeling angry and lack of respect towards one another. This has led to high levels of turnover, and the new manager is currently faced with the challenge of recruitment. Stress and burnout is very important to be addressed because stress and burnout threaten patient outcomes and safety. When healthcare professionals are feeling stressed and burnt out, they become incapable of making the best decisions, and it often leads to medical errors. These medical errors put patients in jeopardy and oftentimes cause medical errors. Physicians suffer from burnout in alarming numbers, yet many of them hide their feelings in fear that it will diminish confidence in their care. Many physicians do not tell anyone that they are suffering from stress and burnout. Other healthcare workers suffer as well. The culture that is sometimes considered the norm in the healthcare field is to hide feelings of stress or to make it feel like it's not as important. Stress and burnout have resulted in $150 billion in lost productivity. The top factors that cause stress and burnout are increase in the workload, healthcare reform, the CMS policies, which is the Center for Medicare and Medicaid Services, and also insurance companies' interference. These factors have led to increased levels of stress and burnout among healthcare organizations. There are many human resources issues involved with stress and burnout. Stress and burnout directly affects recruitment, retention, and turnover. Many times when we're trying to recruit the best candidates, the candidates are very concerned about the culture and making sure that they'll be able to fit in. Once they realize that the culture is not what they expect and a lot of the employees are currently experiencing stress and burnout, the candidates no longer want to work for that organization. Some examples of this include two employees at Crystal Clear dermatology that were still in their 90-day probation and saw that the employees were stressed and burnt out and overworked. These two employees decided to quit as well and did not work for the organization. In addition, a study suggests that when healthcare professionals have increased workloads with a list of things to do that keeps growing beyond the employee's control, employees experience stress and burnout, which leads to feelings of anger. Healthcare workers that experience stress and burnout are likely to call in sick or leave the organization altogether. Employees start to become frustrated with one another and treat new employees without respect. They often feel like they don't even have time to properly train the new employees. Being absent from the organization and high rates of turnover that result from stress and burnout create lower quality care for patients. This also leads to increased medical errors that can lead to lawsuits. A law that is associated with the concept of stress and burnout is the Fair Standards Labor Act. Many times when there's stress and burnout in an organization, it leads to longer hours to take care of the increased patient load. Under the Fair Standards Labor Act, employees are expected to be paid for more than 40 hours. Their employees are expected to be paid overtime for more than 40 hours. Stress and burnout also harms the culture of an organization, especially when individuals are punished for their mistakes, or employees are not allowed to discuss their mistakes. When employees are not allowed to discuss their mistakes, they often hide it, which leads to additional mistakes and lawsuits for unsafe patient conditions. These conditions contribute to threaten patient safety and unfavorable patient outcomes. Also, patients are generally aware and they can sense when the culture of an organization is not as it should be. The recommended strategy for stress and burnout is called, in this case, is called the Know the Signs campaign. The Know the Signs campaign is a low-cost initiative that will use Lean Six Sigma methodologies to change working relationships to avoid stress and burnout. The Know the Signs campaign also involves a shared responsibility from employees and managers and stakeholders to know what triggers employee stress and burnout and to try to avoid them through healthy working relationships and collaborations. These healthy relationships and collaborations will be fostered through huddles and meetings to discuss the triggers of stress and to gain employee feedback and engagement. Employee feedback and engagement are some of the best ways to gain buy-in and have employees feeling like they're valued at an organization, which generally will lead to increases in retention. HR managers may borrow, and it is encouraged that they borrow evidence-based practices from other organizations to improve the rates of stress and burnout. Lancaster General Health currently uses employee huddles to address problems such as stress and burnout. Other organizations, such as Crystal Clear Dermatology, may address this as well, or may use this as well. They may address their concerns of stress and burnout in the same way that LGH does. LGH's method is currently working, and at the huddles, the Know the Signs campaign will be explained and surveys will be taken to see how many people are feeling burnt out. In order to make sure that this strategy is executed, a strategy map and balanced scorecard will be used that display metrics to align the organization's mission and vision along with their performance against these strategic goals. The balanced scorecard is an effective tool to move strategy to execution by observing the system failures and coming up with ways to address the system failures. Some of the challenges to execution include increased financial pressures, complex operating structures, and cultures with multi-stakeholder leadership that are resistant to change. The impact of this strategy will increase productivity. It will also improve all aspects of management. Costs will be saved in the long run by having more employees that are in a better emotional state. Less mistakes will occur and more employees will feel valuable and stay at the organization instead of thinking about leaving and going to a competitor. Also, the community relationships that will be built will be very positive. Patients will receive quality care. There'll be less medical errors. There'll be increased relationships due to staff retention and having a just culture. Improving stress and burnout rates in organizations or even stopping it before it occurs boosts levels of retention and morale. It's a form of quality improvement and performance improvement, and there will be increased employee satisfaction. The huddles are meant to be very low cost initiative for organizations that are experiencing financial pressures. They should last about 10 to 15 minutes and occur once every 2 weeks during lunch breaks, and lunch will be provided. The huddles will offer employees to discuss transparency and accountability. And they may also be able to discuss things like the financial state of the organization and more. Employees would be open to discuss whatever they are feeling, especially feelings of stress and burnout. The benefits of this are that there will be lower turnover rates. There will be less chance of liability or lawsuits. There'll be high rates of retention and recruitment, and overall, the morale across the organization will be increased as well as productivity. The consequences of not addressing job stress and burnout can really become disruptive to an organization's operations. For instance, 24 to 40% of workers express that they are stressed, which leads to around 300 billion in stress-related compensation claims. About 7% of employed physicians between the ages of 29 and 65 reported that they considered suicide within the last 12 months due to stress and burnout. Stress and burnout present a specific threat to achieving the goals under the Affordable Care Act, which are known as the Triple Aim Goals. The Triple Aim Goals are better patient experience of care, improved population health, and lower costs. By not addressing stress and burnout, it defeats the purpose of trying to improve population health, because stress and burnout are linked to lower patient outcomes and patient dissatisfaction. Conclusion. The time to act is now. Stress and burnout can be decreased through a just culture, leadership support, good working condition aimed at recruitment and retention, and positive relationships with direct supervisors and peers. The Know the Signs campaign and huddles will definitely help address this problem of stress and burnout within the healthcare field. A report showed that the employees' message to employers in regards to stress and burnout was pay me adequately, support me on the job, and guide me on my job priorities. And those are ways to increase stress and burnout within the healthcare field. Thank you.